Hello, I am Dr. Catherine Whitkop, and today I'll be presenting on how I practice for contraception. Next slide. This project was supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services under grant number UHO-MC29440, Bright Futures for Women's Health, Standard Practice Guidelines for Well Women Care. This information or content and conclusions are those of the author and should not be construed as the official position nor policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. I alone am responsible for the content of this presentation, and it should not be construed as the position or policy of any other entity. Next slide. I'm an OBGYN and preventive medicine physician. I served in the U.S. Air Force for 22 years and continue to see patients in the Washington, D.C. area, primarily those serving in the military, their family members, and retirees. Next slide. Almost half of all pregnancies in the U.S. are unintended, and lack of or incorrect use of contraception account for a large percentage of these pregnancies. Although recent years have seen reductions in unintended pregnancies among some subgroups, access to contraception remains a problem, and the pandemic made it even more difficult for women to obtain the method they needed. Next slide. As you can see, the Women's Preventive Services Initiative, or WPSI, recommends that adolescent and adult women have access to the full range of female-controlled contraceptives to prevent unintended pregnancy and improve birth outcomes. Next slide. Contraceptive care includes screening, education, counseling, and provision of contraceptives, including in the immediate postpartum period. Contraceptive care also includes follow-up care. For example, management, evaluation, and changes, including the removal of, continuation of, and discontinuation of contraceptives. The WPSI recommends that the full range of U.S. Food and Drug Administration, or FDA, approved, granted, or cleared contraceptives, effective planning practices, and sterilization procedures be available as part of contraceptive care. The full range of contraceptives currently includes those listed in the FDA's birth control guide and includes sterilization surgery for women, implantable rods, copper intrauterine devices with progestin, including all durations and doses, injectable contraceptives, oral contraceptives, including combined and progestin only, and either extended or continuous use, the contraceptive patch, contraceptive vaginal rings, diaphragms, contraceptive sponges, cervical caps, condoms, spermicides, and emergency contraception. Finally, it includes any additional contraceptives approved, granted, or cleared by the FDA. Next slide. As you know, the coronavirus pandemic significantly disrupted clinical care, but in some ways created opportunities to increase and improve telehealth services. Preventive services such as provision of contraception need to continue even in the wake of something like a pandemic. I recommend working with the administrative and care team within your practice to establish procedures to schedule and carry out virtual and in-person visits as indicated. Making women aware that virtual contraceptive counseling is available and providing straightforward instructions for setting up their telehealth visit is an important first step in your practice. Ideally, women would first be scheduled for a timely telehealth visit. Many methods, including the pill, patch, and ring, as well as emergency contraception, can all be ordered for a patient without an in-person visit or physical exam. And for women who choose a method that requires an in-person visit, having a virtual visit prior to the procedure can also serve several purposes. First, it ensures that the patient selects the method that works best for her without the time constraints of an in-person visit. Second, it can optimize the scheduling of the procedure to a time that the clinician be certain the patient is not pregnant. And finally, it reduces the length of time of the actual in-person visit. Next slide. Correct coding can result in more appropriate compensation for services and reduce claim denials. For coding resources, including CPT codes and Medicare and Medicaid guidance, please download the free WPSI coding guide. And for information about coding for digital and telehealth services, visit ACOG's Practice Management Coding website. I'd like to now share some thoughts about contraceptive counseling. I consider shared decision-making as the ideal approach to contraceptive decision-making because a patient's preferences and values are considered in addition to the scientific evidence about a particular method, and the decision is made jointly by the provider and patient. A patient may place particular value on certain characteristics of the method, whether effectiveness, how it's used, how long it lasts, side effects, and non-contraceptive benefits. Individual preferences within each of these areas will likely help narrow the patient's decision to one or two methods, and shared decision-making can then proceed, with the likely outcome that the patient will be more confident in the decision made and is likely to be more satisfied with and continue the method that was chosen. Decision aids are tools that patients can complete before or during a visit that can help clarify values and preferences in preparation for shared decision-making. Next slide. In my practice, I use a decision aid called Decide and Be Ready that is available free of charge through the App Store or Google Play. We at Uniform Services University developed this tool in collaboration with a team from UCSF. It has features for service women, but is applicable and can be used by anyone. After several informational modules, the patient answers a series of questions on the app. The first few questions are demonstrated here. After the patient answers the questions, the algorithm built into the app provides her with a summary of the methods that best meet the values and preferences that were expressed. The app also contains some information quickies on topics like IUDs and breastfeeding, and the capability to contact and record questions for one's provider. This app does not replace a visit with a provider, but facilitates shared decision-making. Next slide. Contraceptives should be made available for all women. We should capitalize on the opportunity to make contraceptive counseling even more accessible and effective by offering virtual visits and digital tools, followed by timely procedures as indicated. There are multiple resources available to help ensure women have access to the contraceptives they need. Listed here are only some of those resources. Thank you for your time and have a fantastic day.